So choosing the catheter, all right, the catheter should be based on the patient's condition. If they need a lot of fluids, you need a great old big one. If all you can get and you can't find a big one, then you've got a 22 here. So you base the size of the catheter on the size of the vein that you can get it in. However, if you've got a patient that is suffering from chest pain or whatever, and they've got a huge freaking rope on their arm, okay? And you look at it and you can say, hey, I can get a 14 gauge in that thing. And let's say you could. Let's say that joker's as big as my thumb. Should you use a 14 gauge on that patient? Probably not. Probably should use an 18. Let me tell you, get what you can get comfortably. I've gone out on guys. I went out on this one guy. He was a new paramedic in the field. And all he talked about was, you know, starting big IVs on folks. And that was his thing, and it was kind of getting on everybody's nerves. And we would go out, and he would try to start these huge IVs on folks. And he would eventually get it, but then we'd look around, and we'd see like a 4x4 taped here, 4x4 taped there, here, and here, and then he got like one 16 gauge. When if he would have used an 18 gauge, guess what? Probably would have had it a long time ago, and then he would have had the patient packaged better before we got there. However, just to let you know, starting an IV comes after getting a patient package that's trauma, right? Your IV should be started when? En route to the hospital, not on scene. Unless you're waiting on transport to get there or something like that, okay? Alright, so the catheter selection should reflect the need for IV administration, the age of the patient, and the location and site. The size of the catheter is determined by the diameter of the catheter. And if you have a patient and you think they're going to need blood, they need at least an 18 gauge needle. That's about the standard size for giving blood, okay? If you're going to give like D50 in an IV, you might need an 18 or 20 gauge. More than likely, the standard size IV that you're going to start in the field is going to be an 18 or 20 gauge needle. That's what your services will go through the most. Anything smaller than that is too small. Larger than that usually isn't necessary unless they're really bad trauma and you need to get a lot of fluids on board. But let me go ahead and point this out. And I'm going to tell you from experience, having an IV is better than not having an IV. So if all you have is a 22 gauge, I'd rather you have a 22 gauge than trying to force an 18 gauge into that vein and blowing it. Does that make sense? So select the largest diameter catheter that will fit the vein you have chosen and be most appropriate and comfortable for the patient. Generally, the more distal the site, the smaller. So remember that, comfortable for the patient. Has anyone here seen a 14 gauge? That joker is like a dart. Think about getting hit with a dart. No fun. Alright, butterfly catheters. The reason we call them butterflies is because they have this little thing here on the side. We call it the butterfly wings. And these are very small ones. Very small. And the plastic tabs allow for a stable anchoring platform because the needle is so small. It is pretty small. Usually used to draw blood, especially in pediatric patients or people who have that are very hard sticks. We typically use over-the-needle catheters, is what we use, what you'll see in use today. And we have now, and I think we've got some Gelcos in there. We've got a little of both. Anybody work for a government entity? With Kevin? Everybody else is private? I don't understand this. But if you work for a government, OSHA doesn't really apply to you as much. So they get away with a lot more. So they will use Gelcos. I work in Walton County, and they use Gelcos. Now, a Gelco has 0 safety on it. The only safety on the Gelco is you. That's it. However, you go to like Newton, Newton EMS is actually ran by the hospital. So they have to apply by all OSHA standards. And they have safety mechanisms. And there's a lot of safety catheters out there in use. And I'm sure y'all have seen some of them, and we'll see them today here in a little bit. So, okay, let me get here about arteries. The main thing that we're trying to cannulate is a vein. We're not trying to hit an artery. But sometimes you will accidentally hit an artery because you don't always don't always see the veins that you're trying to hit. We can feel them, and you'll go for them, and sometimes you'll hit an artery. If you do hit an artery, then discontinue it. Remove it and apply direct pressure. If you're trying to push fluid through an artery, you're going to need like some heavy pressure bags, more likely. And you'll know you have an artery because if you hook up the IV bag, you'll start seeing the blood with every heartbeat work its way up to the bag. So, inserting the catheter, each of you will have your own unique technique. But however, you need to keep the bevel side up during insertion. Now we do that. Now there's a modification. We will go bevel down for pediatrics sometimes that are very small veins. But you want the bevel up for most part. And maintain adequate traction on the vein during cannulation. And I don't care what technique you really use, to be honest with you, as long as, number one, you're sterile and it's appropriate and safe. Some things you can use here, look, they're using a tourniquet there, right, for the top one, and down here they're using a blood pressure cuff if you had to in a pinch. I'd rather use the tourniquet because you get blood all over the blood pressure cuff. And the problem with the blood pressure cuff is that they leak. So as you're trying to start it, guess what? Next thing you know, it's out of air, you lost pressure and stuff. So you want to make sure you prep the site. And we typically use alcohol or iodine. And whatever you do, you're going to start your first round, you're going to start in the middle and do outward circles. Push whatever germs out. Let it dry. Just because you put it on there doesn't mean it's ready for you to go, okay? So advance the catheter, you're going to start at like a 45-degree angle, and then once you get your flash, then you'll come down to a 15 and advance your catheter in. Slide the sheath over the catheter and apply pressure to the vein and remove the catheter. And you're going to apply pressure just past the catheter that's in there so that you don't get blood everywhere. This is where we usually make a mess. That's why I say you might want a towel or something. Sometimes. Now you are also able to draw blood, and you want to draw blood first before you administer fluids or medications, because if you administer medications or fluids, that could alter the blood test. Now we used to do this a lot, and we don't do it as much anymore because there's a lot of scrutiny under labs and stuff to make sure they have the right labs or the right specimens and stuff, and we're not real good in EMS to do it, but we may be able to do this, right? So whenever you go to, you may not want to take your constricting band off immediately, fill up your tubes and take it off, but don't leave the constricting band on there too long because it gets really uncomfortable. And a lot of us have probably been there. And this is an example of someone taking blood from an IV. And whenever you push this into here, make sure you use these little flanges here and you pull like so, okay, with your thumb. Don't push the whole thing in to the patient. So when you do draw blood, you want to make sure you get the patient's name, the date, and the time, and put your name on it to identify that you took it, so that we know who took the